Welcome to another episode of Education CML. Now, let's explore how the logarithmic decrease in PCR results for chronic myeloid leukemia is interpreted. You will find this result in your BCR-ABL1 PCR test report, usually represented by the letters LOG next to a number ranging from 1 to 5. Imagine PCR results as counting snowflakes on a winter day. With CML, there are many snowflakes, like cancer cells, in your blood. When undergoing treatment for CML, it's akin to using a special heater that melts the snowflakes. Logarithmic decrease means that over time, the quantity of snowflakes in your blood decreases in a unique way. Instead of melting one by one, as on a sunny day, they'll melt in larger groups. Think of it as snowflakes grouping together and melting simultaneously, rather than one by one. Each large group is like a step towards relief. Observing a logarithmic decrease in your PCR results is good news. It indicates that the treatment is effective and that the snowflakes are melting in larger groups. In summary, logarithmic decrease in PCR is like witnessing snowflakes melting in larger groups due to treatment. It is a sign that you're progressing toward an improvement in your health. Now let's review how to interpret the numbers in logarithmic reduction. A 1 log reduction means that BCR-ABL1 level has decreased to 10 times below the standardized baseline value. This equates to 10% of cells, 10 out of 100 cells having the BCR-ABL1 gene. Achieving this reduction is considered an early molecular response within 3 to 6 months of starting treatment. A 2 log reduction means that the BCR-ABL1 level has decreased to 100 times below the baseline value. This indicates that 1% of cells, that means 1 out of 100 cells, carry the BCR-ABL1 gene. A 3 log reduction means that the BCR-ABL1 level has decreased to 1,000 times below the baseline value. This means that 0.1% of cells, meaning 1 out of 1,000 cells, have the BCR-ABL1 gene. This is also known as MMR, or major molecular response. A 4 log reduction means that 0.01% of cells, meaning 1 out of 10,000 cells, carry the BCR-ABL1 gene. A 4.5 log reduction is called complete molecular response, or deep molecular response. Physicians may refer to this as MR 4.5. A 4.5 log reduction indicates that 0.0032% of cells, meaning 1 out of 32,000 cells, have the BCR-ABL1 gene. Achieving a deep molecular response is a sign of disease remission. Patients who achieve and maintain a deep molecular response over a significant period may be considered candidates for discontinuing TKI therapy under careful medical supervision. A 5 log reduction means that 0.001% of cells, meaning 1 out of 100,000, carry the BCR-ABL1 gene that indicates CML. Achieving a 5 log reduction means patients have attained BCR-ABL1 undetectable phase. This does not mean to be leukemia-free, but rather this indicates that if any leukemia cells is on your body, the PCR testing machine cannot detect it because it will be under its detection threshold. For patients, qPCR tests are recommended every 3 months initially. After 2 years of achieving and maintaining the BCR-ABL1 level of 0.1% or less, tests should be conducted every 3 to 6 months. We hope these explanations has clarified the concept of logarithmic decrease. If you have more questions, don't hesitate to ask your doctor. Wishing you success in your treatment and a fulfilling life. See you next time.